Well, of the many medical challenges facing the United States at the moment, one of the biggest is the Zika virus. There are now more than 2,200 confirmed cases in the U.S., and more than 500 of those patients are pregnant women. And the number of locally transmitted cases continues to rise as well, with more than 40 infections in the state of Florida alone. And for our nation's top doctor, well, the Zika virus is a personal concern. And to discuss it all, I'm now joined by Surgeon General Vivek Murthy. Good sir, thank you for joining us.
Of course, glad to be here.
I want to begin with the Zika virus, which seems to be something of a burgeoning crisis now, at least here in the state of Florida, as we're seeing more non-travel related, locally transmitted cases there. We've heard from Florida Governor Rick Scott saying that he will look to allocate as much as he can to combat the spread of the virus, while also saying that the federal government has essentially deserted the state. Is enough being done, and really what more can be done to get those almost $2 billion in funds that everybody many seem to agree is required, made available to do what needs to be done?
Well, for a few things I think it's worth to establish first. One is that we are seeing more cases of non-travel related Zika in Florida. And this is a situation that we foresaw many months ago when the president asked for $1.9 billion to fund the Zika response effort. But I'm happy to say that Florida and the federal government, specifically the CDC, have been working closely together for many months to prepare for this moment. They've been working on public education, on expanding the availability of diagnostic tests, and on mosquito control measures. The question, though, is how are we going to continue these efforts going forward? And in particular, how are we going to continue vaccine development efforts? And that requires funding. And that's why it's so important that we act now and that Congress allocates that money. Because the truth is, we need to become a country that's better at acting early rather than waiting until problems become big and acting late. That's a shift in mentality that we haven't fully achieved yet.
And this is, there is a gestational lag to this issue, in that with regard to microcephaly and the severe impact it can have on babies born with it. The babies that might be contracting Zika, as you and I are speaking right now, will not be born until really the middle of next year. How to combat a problem that may not really make its face public for 9 to 10 months?
Well, you've hit on one of the great challenges when it comes to public education around Zika, which is that the concerns we are most worried about, the consequences of microcephaly and other birth defects, do not appear often for many months after the initial infection. But we want people to take this seriously so we can prevent future consequences. And that's why public education efforts are so important. It's also why it's important for us to look at what's happening in other countries. If we look at Brazil, for example, we've seen many cases of microcephaly there. So this is real. And that's why it's so important for us to make sure that everyone, pregnant women in particular and their partners, know the steps that they can take to protect themselves from mosquito bites and from sexual transmission of Zika.
Where is the vaccine production right now?
Right now, we have started phase 1 trials on a vaccine candidate. After that, we'll have to begin phase 2 trials, but phase 2 trials will require planning and financial support that has to begin right now. The Secretary of Health and Human Services, Secretary Sylvia Burwell, has already reallocated funds within HHS to support vaccine development, given that we don't have money from Congress yet. But that has come at a price, which is that we've had to take money away from other research efforts, including cancer research. That's not a good way for us to deal with a public health threat. And that's why what my hope is that not only that we can fund the Zika response fully, but also that we can set up a public health emergency response fund so that we're not in this situation in the future.
Another scourge really facing this country, and to which you are responding, I know, is the opioid crisis. You recently sent letters to some 2.3 million prescribers asking them to help. What specific actions then are you looking to have occur as we, again, combat something that really has so many regions of this country in its grip?
Yeah, so today, practitioners all across the country, 2.3 million of them, should begin receiving a letter from me about the opioid crisis. This is a letter asking them to join the national movement that we are building to turn the tide on the opioid epidemic. And there are a few key things we're asking practitioners to do. Number one, to sharpen their prescribing practices so that we are treating pain safely and effectively and not writing prescriptions for opioids that are not safe or necessary. Second, we're asking them to connect people who need treatment to that treatment. Right now, we have over 1 million people in America who need treatment for an opioid use disorder but can't access it. And third, we're asking clinicians to help us change how our country thinks about addiction. For too many people, addiction is seen as a character flaw or as a moral failing, but we want people to see it for what it is, which is a chronic disease of the brain that we have to treat with urgency, with compassion, and with skill.
For somebody perhaps casually sampling the news, they've seen that headline, the opioid crisis, the opioid epidemic. Just how dire is the circumstance?
This is one of the most pressing public health threats of our time. We have seen a quadrupling in the number of people who have died from overdose deaths since 1999. We have nearly 2 million people who are addicted to prescription opioids. And we have found now that the prescription opioid epidemic is contributing to the use of heroin and to the spread of HIV and hepatitis C. So this is an epidemic that is growing in its scope and in its impact. And just from a human perspective, I have seen families suffering all across this country as I have traveled on our Turn the Tide tour. I've met with parents who have lost kids to overdoses. I have met with husbands and wives who are struggling to figure out how to get their spouse into treatment. And even though there's a massive financial cost to this epidemic, what worries me most is the human toll this is taking on our communities. And that's why addressing the opioid crisis is a moral imperative, and it's one that has prompted me to send this letter to 2.3 million practitioners, and also to build this larger campaign, Turn the Tide Tour, where we are urging doctors to go to turnthetiderx.org and join the movement that we're building all across America.
And you mentioned campaigns, it's election season. Healthcare has largely been reduced in the election cycle to either attacks upon or defenses of the Affordable Care Act. Are you hearing enough from Donald Trump and Hillary Clinton with regard to this issue, and what more perhaps could they and their campaigns do?
Well, to be honest with you, I've been focusing my efforts primarily on addressing the public health threats and not necessarily to listening what candidates are saying right now. I'm certainly looking forward to working with whoever the next president is on addressing the most urgent public health threats that our country is facing. And those include opioids, it includes the challenges we have with Zika right now. But there are other challenges as well. You know, we are dealing with chronic illnesses in our country like diabetes and heart disease and obesity, which require a prevention-based approach. And as a country, we historically have not been great at prevention. We focus the majority of our resources on treatment, but we have an opportunity now to shift that balance, and that's what I'd like to do with the next president of the United States.
We've seen some breaking news today with regard to a medical issue, and that is the price for life-saving allergy medicines. It's risen nearly 500% in the last decade, but just today, this morning, Mylan, the company that makes the EpiPen, has announced that it is slashing patient costs amid outrage over these skyrocketing prices, looking to remove the burden, frankly, from parents and their families who need the medicine they provide. What do you make of the news we're hearing just this morning? Well,
high drug prices are a concern for millions of people in America, and I've heard this not just as Surgeon General, but when I was practicing medicine in Boston, many of my patients had difficulty paying for their medications, and I know that this is a real problem. What we saw recently with the price of EpiPens going up was just one more example of how drug pricing is a major problem in America. And that's something that we have to address. It's one of the reasons why I believe we should have the ability to negotiate drug prices with pharmaceutical companies when it comes to Medicare and Medicaid. But the bottom line is that people need relief, and they need relief in terms of drug prices and in terms of overall healthcare costs. I was happy to see that the company is today thinking about taking action to reduce prices. I would hope it wouldn't take an uproar to elicit that kind of response. But the bottom line is all of us have a responsibility, both a financial and a moral responsibility, to make sure people can get accessible, affordable care.
And here you are keeping these issues in public eye. Doctor, thank you so much.
Thank you so much.
Really appreciate it.
Great to be with you.